Emma.
Hi.
How are you doing today?
Good, how are you?
I'm good. So what would you like to work on?
My neck.
Okay, tell me a little bit about it. How do you have pain? Is it tightness? Describe it to me, and how long has it been going on for?
Probably about a year, especially with
Okay.
university sitting.
Yeah.
A year ago, I kind of messed it up when I was trying to tug on a door.
Okay.
And then I got like shooting pain down here, and it was really hot, and I couldn't move it past like a certain point.
Okay.
I haven't had it happen since then, but I just get scared that like it's going to reoccur. So
Okay.
yeah.
Do you ever get any like muscle spasms or headaches?
I
because
get
of your-
headaches sometimes,
Okay.
but not like too often. It's just like,
Okay.
every so often.
Is it usually around like exam periods?
Yeah, like if I'm like, especially if I'm staring at a screen for too long.
Okay. And are the headaches here or are they in the back?
Here.
In the front. Okay.
Yeah.
How is the rest of your body feeling?
Good, except just my hips. They lock
Okay.
sometimes and they pop because my mom has arthritis, so I feel like I'm maybe starting to get some of those symptoms as
Okay.
I'm getting older. But so yeah, just the popping and the locking.
Okay.
Sometimes when I'm working out and I'm doing a lot of like hip or like glute workouts and stuff like that, they start to lock and I need to like get up and like move it.
Okay.
So,
Are you doing any sort of mobility before you do?
like other than stretching?
Other than stretching?
That's, yeah.
Okay, we can go over some things and I can give you a few exercises you can do prior to working out.
Okay.
That'll keep them a little bit looser.
Mm-hmm.
So you said it locks during your workout. Do you get that popping
Yeah.
feeling as well?
Like if I move it, sometimes you could hear it like
Okay.
literally.
Is it a
popping.
certain movement?
It's a lot of like if I'm like doing like mat workouts or something, and
Okay.
if I'm doing like moving my hip like up like this or stuff like that,
It'll pop
it'll
out.
pop out.
Okay.
Yeah.
Is it
And
painful?
hurts. Yes.
Okay.
Like sometimes it locks to the point where it's like, okay, I need to actually get out of the movement.
Okay. And is it pain in the front of the hip or is it more in the back of
It's
the
like
hip?
right like in the side.
Okay. And is it
Yeah.
both sides?
Yeah.
Okay.
For the most part, I feel like it's more on my right side
More
because
on the
I
right
use
side.
that more. But
Okay.
like it's happened to both of us.
So more the right of the neck and then the right
Yeah.
hip as well.
Mm-hmm.
Okay. Anything else you want to look at?
I think that's everything.
Okay, so I'm first going to start by taking your blood pressure.
Okay.
And then I'll do a little bit of an exam on the hips and on the neck as well, okay? So I'll come and I'll do this one actually. So you can we'll just roll that up. I need it a little bit past your elbow.
Okay.
Is that too tight on you?
No, that's okay.
Okay. So I just like to take blood pressure just to get a standard of your health.
Okay.
There are certain things we don't want to be doing when someone has high blood pressure.
Okay.
I wouldn't imagine that you do, but it's just like a precautionary.
Okay.
I want to get this up just a little bit further if you don't mind. Okay, yeah, that's perfect. And do you have a family care doctor?
Yes.
Okay, how often do you go see them?
Not very often. I went to see her in the summertime,
Okay.
and then she sent me to go. It was a new doctor, so I used to go to a older one,
Mm-hmm.
and then I switched to a new female doctor that just like got registered.
Okay.
And then she sent me to get my blood done
Mm-hmm.
and stuff, and she never like called me back
Okay.
about anything being wrong. So
Okay, that's good.
Yeah.
Okay, just relax here for me. Okay, you're good. 118/78. You're normal.
Okay.
Have you had any surgeries or any hospitalizations that I should be worried about? No. And we've already talked about your medical history and the
Yeah.
medications and stuff,
Yeah.
so we don't have to mention that. Okay, good. So let's start first with your neck. So we're just going to go over your range of motions. I'm just going to have you
Okay.
leaning certain ways, and we'll see if any spot is tight, okay?
Okay.
So you can come around here. Be moving around a little bit. Okay, so let's first start with just bringing one ear to one shoulder. Any pain on that right side?
A little bit.
Okay, do you have any pain on the left?
No.
Okay, and then come this way. How does that feel?
It's like the same. It's right here.
Okay, and then come back neutral, and then look towards the windows. Anything with that?
No.
And then look towards the door. Anything with that one?
No.
And then look back at me, and then up. Anything there?
No.
Okay, and then look down.
No.
Anything with that?
No.
Okay, I'm going to come behind you and I'm going to do those similar motions and I'm going to be pressing down on your head. I want you to let me know if you have any pain in the neck or any radiation shooting pain down your arms, okay? So just come behind Any pain with that one?
No.
And then forward. Any pain with that?
No.
And then behind. Any pain with that one?
No.
No. Okay. Just feeling around here. Okay, let's do some things for the hips. So I'm gonna have you now. Let me just move this out of the way here. So stand up for me. And have you back up a little bit towards the wall there. Okay. So I want you to do just a general squat for me. You can go as wide as you want. Okay. Go one more time. Do you have any pain with this motion in your hips?
No.
I'm going to put my hands on your low back here and then squat again.
It's just like there.
Right there. Okay. Come
Yeah.
back up. And then come back down. Okay. Come back up. Do you feel like you have a stronger hip?
I
can't
don't
tell.
know.
I would say that like your left hip is a little bit stronger to
Okay.
me, which makes sense because if that right hip is hurting, your left hip is going to be compensating,
Okay.
right? So
Yeah.
all of the muscles, like your glute muscles, your quad muscles, your hamstrings, are all going to be a little bit stronger on that left because you're not putting as much weight on that right side.
Okay.
Let's have you now, I'm going to have you take your shoes off, and then you're going to go onto your back on the table.
Okay.
And I'm going to look into that hip a little bit more. So on your back. Perfect. So I'm going to first start testing the right one.
Okay.
Actually, I'm going to first start by testing the left
Okay.
because the left is your good one.
Okay.
Okay, so I'm going to come up here. And I'm just going to see how much range you have in internal and external rotation. Any pain with either of these?
No.
I'm going to be pushing down in here. Any pain with that?
Mm-mm.
Okay, I'm going to go here. Any pain with that?
No.
And then here. How's that?
Like I don't know if it's just when I'm using it to, you know what I mean? Like, because none of that, I would say, hurt.
So first thing that I'm noticing, even with your left hip, is do you see how your knee is a little bit above?
Yeah.
So look down and see where your knee is. I ideally want your knee to be like that.
Like, okay.
And for it to be sitting there naturally when I'm doing this test.
Okay.
When your knee is a little bit above like this, that's showing me that the hip flexors in the front are tighter than I would like them to be.
Okay.
And the tighter the musculature around the hip means it's holding on
Yeah.
a little bit more.
Yeah.
So let's see this one. So first thing, so you have good range of motion. Any pain with any
No.
of these? Okay. Put that there. Any pain in there?
No.
And then let's do this one here. I feel like this one's better.
Yeah.
Okay. Does it pull here on the front?
Yeah.
A little bit. Okay. Let's have you now. So what I'm going to do for you, I'm going to do a few different things. I'm going to first have you come sit back up, and I'm going to do some muscle work on your neck.
Okay.
So I'm going to be doing a technique called active release technique.
Okay.
So essentially I'm taking that muscle, I'm shortening it, I'm applying a little bit of pressure, and then we're going to lengthen it. That's allowing the muscles to glide a little bit better beside the other structures. So it could be other muscles, could be other ligaments, tendons, nerves, arteries, the whole thing. Then I'm going to have you go face down, and I'm going to turn the flexion distraction table on. So that's going to stretch out your muscles, but as well as your spine. And then when I'm there, I'm going to feel for what muscles feel tight, especially around the hips and the low back. And we'll work on relieving any tension in there. And then we'll get you adjusted. I might do cups today. I might do scraping. It'll just kind of depend on how I feel.
Okay.
Do you have any questions? Okay. Let's go have you come sit up for me. And then you can swing your legs over that way. Okay. And you have been to a chiropractor before.
Like, not in probably 15 years.
Yes. What were you going to them for?
That I don't know. You'd have to ask my mom.
Okay.
That question.
You're like, I can't really remember.
I was so little, I don't even know.
Okay. So we're going to do a little bit of muscle work here. So I'm going to have you shrug your shoulder up. Good. I'm going to have you bring your head here. And then I'm going to apply pressure and then drop your shoulder slowly. Good. And then we're going to lean to the right. Good. Now let's do that again. So shrug your shoulder up. Good. Drop your shoulder and then lean to the right. Good. And then come back up. And then lean to the right. Good. And then come back up. And then lean to the right. Do you feel any tension in there? And then we're going to do it a few more times, but I'm going to have a different context, so shrug the shoulder up. Good. And then lean to the right. Good. And then come back up. And then lean. Good. And then one more time. And then lean. Good. I know it's a little tight in there.
It is.
So let's do these muscles here in the back. So you're going to bring your arm out to the side, and then you're going to cross them across your body. So we're going to start here. So let me get the contact, and then cross over. Good. And then come back out. And then cross over. Good. Come back out. And then cross. Good. And then come out. And then one more cross. Good. And then lower it down. And then we're just going to find some spots in your neck here. Okay. So we're just going to start right there. And then you're going to bring over. I can kind of guide you. So you were young when you first went to a chiropractor?
Yes.
And I'm sure they did no muscle work like I'm doing right now, right? Yeah. Usually the younger that you are, the less muscle tension you have.
Yeah.
And then look down just a tad. And then one more here. And then look down. Good. Now let's do your other side. So we're going to start with that first one here. So shrug up. Good. And then drop your shoulder and then lean to the left. Good. And then shrug up. Drop and lean to the left. Come back up. And so tell me a little bit more about your exercise routine. How often are you exercising and what are you doing?
About like 3 or 4 times a week. In the summer, I was doing reformer Pilates.
Okay.
And then I was also going to the gym. Like, I just always start with like incline walk. And then usually like I just either do like a cardio core day. I do back, like I just use a lot of kettlebells or what's called free weights.
Here, and then cross. Okay.
So yeah, nothing too heavy. Like I just try to do just like light weights and like more reps of things.
Yeah.
I don't really use machines that often. I kind of just use like free weights, and then I do like the reformer.
Yeah, I know, that's
Pilates
great.
and stuff. So I would say it's fairly low impact that I'm doing.
Yeah. And so are you doing more exercise when you're when it's the summertime, like when you're not in school?
Yes.
Yeah.
I try to do it at school. Like I have a gym membership at school.
Yeah.
But obviously it's hard to.
It's so hard.
Yeah.
It's so hard to do all the things
Yeah.
you need to get
exactly.
done. Yeah. Okay. And so can you pinpoint the exact exercise that bothers the hip the most? Like, is it a squat? Is it a lunge? Is it a hip thrust?
I would say I was using like the abductor and adductor machine, but I stopped using that because it like hurt me so bad, even like the next day.
Okay.
And I noticed things when I'm like doing Pilates. I haven't really done it since the summertime, but a lot of like she always will come up behind me and have to adjust my hips because like you were saying, they're like off a bit, and I can't like, when I'm on all fours doing any like glute work, it's hard for me to keep my body in line because I'm always leaning to this side because this side hurts.
Yeah.
So I feel like it locks when I'm doing like anything like adducting and abducting with my hip. I feel like is what hurts. Yeah.
Okay, let's go face down now. So I'm going to work on a few different muscles on you. Just based on what you said now, I can tell there's certain muscles like the piriformis muscle, your glute med, your glute max, that are all inserting to your sacrum.
Okay.
And are responsible for that abduction motion, right? So bringing your legs out so you can relax your head down. So when you're at the gym and you're working on that abductor machine, it's really going to be firing your piriformis as well as your glute med. So we're gonna start with those, and then we'll see what else I want to work on. Okay. So this is the flexion distraction table. I'm gonna turn it down just a little bit. Have you ever been on one of these?
No.
How does it feel?
It feels good.
It feels good.
Yeah.
So this does a couple different things. The first thing that it does is it allows your body to be stretched. So it's stretching out the muscles in your low back, in your mid back, and in your hips. But the most important thing that it's doing is it's gapping the joints in your lumbar spine, so your low back. And so as you know from school, we have a bone, and then we have a disc, and then we have a bone, and then we have a disc. And over time, those discs get a little bit worn out. And so what this does, it allows more space within the disc to prevent injury and to prevent pain and arthritis from forming in that area. Does that make sense?
Yes.
Yeah. You're like, I didn't even know a table could do all of those things.
No, exactly.
Any pain when I'm touching either sides of your hip here?
No.
Like this one?
Right there.
Yeah, I can feel like that the part of your SI joint, and even a little bit on that right side too. Just gonna take the back of your neck right here.
This side hurts.
The right side?
Yeah.
Yeah. Okay. And you did get a massage yesterday, right?
Yeah.
How did that feel in your body?
It felt good, but some of the times I was like, well, I could tell that like she was working out the knots, especially around my neck area, and like right around like the back of my right around here,
in between your shoulder blades. Yeah. Yeah. So there's certain things that I do when I'm testing your range of motion that tell me it's a muscle issue and that you should get a little bit more muscle work done. So whether that's me performing ART on you, doing scraping, doing cupping, or you going to see a massage therapist. And there's certain things that I'm checking for that tell me that it is strictly a joint issue and that you need to be adjusted. And that's part of my job to figure out which one we have to work on, right? So I'm just gonna feel your low back muscles here.
Right there.
Yeah, so I can already feel right in there. So I'm just gonna hold, and we'll see if this muscle will release itself. So what are you studying in university?
Health science.
Health science.
Yes.
So how much of the human body have you learned about?
I would say most of it.
Okay.
Like we did like the whole like musculoskeletal system. We did the brain, the neural system.
Pull this up.
Yeah, I learned like a lot about the bone structures and like the arteries, and we did like the heart and stuff. But it was only one class that they tried to pack it all into when I was in second year. But obviously you go deeper into it as you need to. I just didn't really need to follow that path because I'm focusing more on nutrition. So, yeah.
The nutrition side of things is really interesting, huh?
It is.
I was actually listening to a podcast this morning on nutrition.
Ooh.
Yeah.
I need to start listening to stuff like that.
I'll give you the one that I listened to. I think you would like it. So I'm just working into your piriformis here. How does this feel?
Yeah, it hurts.
It hurts, yeah. So what I'm finding for is trigger points. So they should be painful when I'm pressing on them because it's an area that's holding a lot of tension. Right, so right in there as well. You okay?
Yeah, I'm good. Okay.
You can let me know if you need me to back off.
No, it's okay. It feels like, I know it sounds weird to say it feels good, but
yeah,
it does.
So I'm just going to be working in here. How's this side?
Yeah, it hurts.
Okay.
It's definitely worse than the other.
One more. Okay, so I'm going to lower that down. I'm going to do some cups on your low back, okay?
Okay.
Have you ever had cups before?
No.
Okay. So the first thing I'm going to do is I'm going to put a towel down underneath your tights so that I'm not getting anything on them.
Okay.
And then I'm going to put some emollient. So it's just basically a lotion that I put on the area that I'm going to apply the cups. Some people do emollient and some people just put the cups straight onto the skin. I like using the emollient because then I can move the cups if need be.
Okay.
We probably won't do that today, so come up and actually see. We won't be doing that today. I'll just leave them. And so I like the cups for a few different reasons. The first reason is because it's bringing blood flow to the area. So these low back muscles of yours have been working overtime to help compensate for the hip.
Okay.
And so bringing blood flow to the area helps the muscles heal and relax a little bit better. It also tells me how much inflammation you have in these muscles. So the redder the tissue gets, the more inflammation that area has. And so it allows me to kind of pinpoint a little bit better where you're holding a lot of your tension. So for you, like on this right side, I can tell automatically the right side is redder than the left.
Okay.
And then specifically this one right here, where you had that pain and that trigger point where I was pressing before, is the reddest.
Okay.
So it just gives me kind of a general idea. And we won't keep these on too long. How do they feel?
It feels so weird.
So weird.
But it feels like, obviously it's like a lot of pressure.
Yeah.
But
If only you could see what they actually looked like.
I could only imagine.
I can show you later. So now I'm going to pull them off. So I don't like to keep them on too long. Some providers like to leave them on until you're bruised. I don't believe that's necessary.
Yeah.
So let me just wipe off the emollient for you. So you might have a little bit of marks.
Okay.
They should kind of dissipate over the next few days. I don't anticipate it to stay too long, okay?
Okay.
So now what I'm going to do is I'm going to adjust your mid-back before I move you in different positions, okay? You can come around here. So right here on you, I feel like this is super tight, right there. So I'm just going to lower the table down. And we're going to start here. So I'm going to have you take a deep breath in for me. And then blow it all the way out. Good. How was that?
That felt good.
That felt good, right?
Yeah, I felt it all the way up to my neck when I did.
All the way to your neck.
Yeah.
Good. So now let's see about the hips. So you can see from here, this left is a little bit longer. So I'm going to have you now, let's have you first go on to your left side. And I'm going to work into this right hip a little bit more before I adjust it.
Okay.
So we're just going to do a little bit more work. So you're going to bring your leg out here, and then you're going to bend it into your chest.
Okay.
Okay, so start out, and then bend it in. Yeah. Okay, come out, and then bend it in. And then come out, and then bend it in. Good, and then come out, and then bend it in one more time. Perfect, and then you can come back out. And I'm going to do another one right in here. Okay, so here you're going to bring this leg in like that, just like the last time, but you're going to twist your upper body towards me. Yeah, perfect. Okay, come out, and then twist. Good, and then come out. One more. Twist. Good. Okay, you can relax right there. I'm going to come on this side. And I'm going to adjust this. On this one, I'm going to adjust your hip.
Okay.
So here, bend. So have you had this adjustment before?
No.
Okay. So I'm going to cross your upper arms like this. Here, here. You can look over your right shoulder. Good. So I'm going to rotate you a little bit more towards me and then do a little drop. Do you feel how that feels a little locked out? So just here. How was that? Good?
Yeah.
And then you can flip onto your other side. And so this one I'm going to be adjusting more so your actual low back, okay?
Okay.
So just right here. So look over your right shoulder, your left shoulder now. So I'm feeling in there, and then I'm going to come up a little bit more. So here. Good. How's that?
Good.
Okay, and then on your back now. Lower that down. feels pretty good. So we've already done some muscle work here, so you should feel pretty good. Lower down. Let's see if there's anything else. So one thing I didn't work on was these muscles here at the base of your skull. How do they feel?
I could tell.
You could tell, yeah. So these muscles here are responsible for headaches when we study too much. Is it painful?
Yeah.
Yeah. So I'm going to loosen these up, and that should help alleviate any headache feeling that you have. Good. And then let's try this side. So here, cross. One more. Okay, just relax your head down there. So these muscles here now feel a little bit better. Can you feel that too?
Yeah. But
the muscles here in the front part of your neck, these don't feel great still. So let's work on those a little bit more.
Okay.
So just have my fingers kind of on the side of your neck. Can you guess which muscle I'm working on?
I don't remember.
The scalenes.
I don't think I
learned about those ones?
No.
Yeah.
I don't think so.
They're smaller, more intricate muscles, and there's 3 guys. The anterior, middle, and posterior scalenes. But these ones get really tight when you have that flexed forward position in your neck, so when you're looking down. Good. And then we'll see the other side. How you doing?
Good.
Good. And then one last one here. Good. Okay, let's see. Okay, so now we're going to do an adjustment.
Okay.
So the way I decide where I'm going to do the adjustment is based off of which joint feels like it's not moving. So when I'm feeling you, so down here feels okay. Then I get to this segment here, and you can feel it feels locked out. And then I come up a little bit, and this also feels locked out. So here on the left, this is a little bit more, and on the right, it's right here a little bit more. So that's where I'm going to be applying the force, okay?
Okay.
So, yeah, perfect. So I'm going to first start with this right side. So I'm going to put my contact right here. Yep, so just relax right there for me. Good. How was that? It was good.
Yeah.
Yep. Perfect. Now we're going to do the other side. Yeah, so it'll be just a little bit lower, so like right in there.
Okay.
So I'm going to bring you over here. I'm going to apply the contact. And then just a little push right here. Good.
Wow.
Huge release, huh?
Yeah.
Good. And then now I'm just going to do a little traction to allow those muscles to relax even more. Good. Okay, let's come now. I'm going to check just the front part. That feels okay. No pain in the shoulder. Okay, let me check your wrist. No pain in the wrists.
A little bit.
A little bit. Okay. So you remember when we were doing that one test where your knee wasn't totally parallel?
Oh, right there.
So this is the muscle that we're working on.
Okay.
So these are your hip flexors, your psoas muscle, if you remember that one. We'll just loosen this up. You didn't realize it was going to be a little torturous, huh?
It's okay.
She's like, I thought I was going to come in as be nice, relaxing. Not so much. Okay, come a little bit closer here. So I'm going to do a little bit of a pull right here. It's going to get your hip, but it's also going to get your ankle as well. So just right here. How's that? Okay, let's do this one. So not as much movement there. Let's see this hip. So this one might be a little bit more painful than the other side. I know. A little bit more. Good. Last one. Gonna relax that down. Let me check this shoulder. It's good. No elbow issues.
No.
Good. And we'll do this hand.
Right there.
You could feel it, huh? Good. Perfect. First thing I'm gonna do, I'm just gonna lower, we'll start on this side. So I'm gonna have you lean to the left. Good. So this is the scraping tool. This allows the muscles to relax after we worked on them. Yeah. Good. Now you can look to the right. This other side. And so you can't really see, but we can see that the muscles are getting a little bit red. So we're bringing blood flow to that area. We're allowing everything to relax a little bit more. And so I can see already by this that your right side's a lot tighter than the left. Okay, so I'm just going to leave some of the emollient on, and then I'm going to do a little bit of cupping, okay? So I'm going to use the same cups that I used on you prior. How do they feel up here?
Good. It's
A little different?
Yeah.
Yeah, a lot of tightness,
Yeah.
huh? Yeah. Guess which side's redder? The right, yeah. Can you feel that?
Yeah. It's like puffy.
Yeah.
A lot more pressure.
A lot more pressure.
Yeah.
Yeah, so we'll just leave those on for a second.
Okay.
Now I want you to do a little bit of neck movement. So look down, look to the right, look to the left. Move your arms a little bit. So you can bring your arms, like bring this one out in front of you. And you see how that changes the position of things? So even though these muscles are in your back, you moving your arm and your shoulders being a little bit rolled forward when you're studying is going to be pulling on these muscles in your back. And so that's why, you know, our posture when we're studying and our posture in our day-to-day life is so important because it affects every single muscle going all the way down to, you know, our low back.
Yeah.
Let me just move. This just gives a cooling effect. Allows those muscles to relax even further so that you can feel good for the rest of the day.
Okay.
Okay, Missy, you're all set. How are you feeling? Come
Good.
stand up, move around a little bit.
I still feel in this side of my neck.
You still feel it.
Yeah.
So that's totally normal. So
Okay.
you might still feel it after today.
Okay.
And you might feel a little bit sore after the adjustments. But tonight and tomorrow morning, the muscles need a little bit time to relax.
Okay.
So tonight and tomorrow morning, you should feel like a huge sense of relief.
Okay.
It's not always like an immediate, like, oh my gosh, my pain
Yeah.
is totally gone. It should feel a lot better.
Okay.
But sometimes it takes a little bit for those muscles to relax fully.
Okay.
Especially when you haven't had an adjustment in a
Yeah.
while, and especially when you're, you know, exercising as much as you are, and studying as much as you are.
Yeah.
You're putting a lot of stress on those muscles. So for it to be gone completely after one isn't super realistic. But we can talk about like a treatment plan and prognosis and stuff to get you to the point where you're feeling chef's kiss
Okay.
all the time. Okay?
Okay.
Okay, you're all set, madame.
Thank you.